Welcome to this webinar on routes of immunization. Today we'll talk about routes of immunization. What are we going to talk about and what are our learning objectives? First of all, we will discuss the different routes of immunization. And secondly, we will talk about how each route of immunization actually works. And then finally, we will discuss how to communicate each route of vaccination or immunization to patients. First, let me introduce myself. My name is Lieke de Vrankrijker and I work as a pediatric infectious disease specialist at the Wilhelmina Children's Hospital in Utrecht in the Netherlands. I did a PhD where I did research on interaction between RSV and bacteria. Before I start off this webinar, I first would like to explain two terms that we will be using throughout the webinar, and I think it is important that we are on the same page as to what they actually mean. So first of all, there's the word or term immunization. Immunization is actually a process. It is the process of getting an immune response to protect a person from a certain disease. Vaccination is not entirely the same. By vaccination, we mean the means of getting the body to develop an immune response against a disease. So now you know that they are not exactly the same, but as you may have noticed, a lot of people, and we also have used both terms interchangeably. So what are those different routes of immunization that we will talk about? First of all, we'll talk about intramuscular immunizations. Secondly, intranasal. The third route will be the oral route. And then finally, we will discuss a very new development, which is called transcutaneous immunization. So I'll start off with the most common type of immunization, which is intramuscular. As I said before, this is the most commonly used route, and I think a lot of you will have had experience with immunizations through the muscles. How does it actually work, and how to explain it in a simple way so that patients or parents know what it means. Well, it's important to look at this figure. I realize that this is a very complex figure, but we only need to focus on the vaccine and the cells and the antibodies. So first of all, we have the vaccine. The vaccine contains a small part or an inactivated part of the pathogen, for instance, a virus. We inject it through the skin into the muscle, and inside the muscle, a certain type of cell called the dendritic cell will pick up that part of the vaccine called the antigen. What then happens is that the dendritic cell moves towards a lymph node. You may recognize lymph nodes if you feel in your neck. And inside the lymph node, the antigen will be presented to another type of immune cell, which is called T cells. The T cells will then develop into specific types of T cells and will also stimulate yet another type of immune cells called B cells. The B cells are very important because they will go on to make antibodies, which you see in this part of the figure. The antibodies will be long-lasting and will provide protection in case the person comes into contact with the pathogen. It is important to realize that there are two types of immunization. The one that I've just discussed and explained to you is called active immunization. We call it active because it requires the body to actively produce an immune response. But there's also another type of immunization which we call passive immunization. And like the word says, we don't expect anything of the immune system in the case of passive immunization. So what happens? In passive immunization, we skip this entire part where the body has to work. So in the laboratory, the antibodies are produced, and then in the final step, the antibodies are administered to the patient through vaccination, for instance, through the skin. And then the antibodies will be used by the patient in case the patient comes into contact with a pathogen. So this entire part is not necessary in that part. So what are the advantages and disadvantages of intramuscular immunization? The most important advantage is the fact that it is very easily administered and also that the absorption is very good. However, an important disadvantage is the fact that we need a needle to administer this vaccine. As you can imagine, especially children, but also a lot of adults might have problems with getting the needle. It might be painful. So this is an important disadvantage. And the second disadvantage is the fact that the vaccines need to be kept in cold storage. And this might offer problems if there's a long distance between the place of distribution and where the vaccine needs to be administered. Very important disadvantages. We go on to an entirely different method of immunization called intranasal immunization. This is a relatively new development. Maybe you've heard of intranasal immunization in terms of influenza vaccines, which can be administered through the nose. How they work is that the vaccine, which is in a sprayer device, is administered through the nose. So you kind of just spray it into the nostrils. And then in the same way that the antigen is presented, like I just showed you with muscular immunization, the antigen will be absorbed by the mucosa of the nose and will lead to an immune response by again stimulating the T cells and the B cells. And the advantage, or what makes this route different from the intramuscular immunization, is the fact that it will also offer some local immune response. So not only a systemic immune response in the entire body, but also a local immune response. And this might be important in the case of viruses that will enter through the nose. And that is one of the most important advantages of this intranasal immunization route, because it is very easily administered and it offers local immunity, which is important for those types of viruses that enter through the nose. But there are also disadvantages. So one of them is that the absorption, so the way the body will absorb the immunization, might be variable. You can imagine if a person has a cold or a swollen mucosa in the nose, the absorption might be variable. Also, a lot of the diseases that we would like to use this immunization route for are still under research. So next up is the oral immunization route. The oral immunization route is already widely used, for instance for poliovirus or for rotavirus. And how it works is that the oral immunization route uses, for instance, capsules or suspensions, where, similar to the intranasal route, an immunization product is administered, this time through the mouth, and is then absorbed by the gut, so the inside of the epithelium of the bowels. And what it does then is similar to the vaccine that is given through the nose. So it will evoke an immune response, it will evoke T cells and B cells, but also it will evoke a local immune response, similar to the intranasal route. And comparable to the intranasal route, the fact that it is easily administered is also an important advantage. So especially for children, you don't need needles, you can very easily give it to them. Furthermore, it will also induce a local immunity in the gastrointestinal tract, which is important for instance, poliovirus and rotavirus. There are also disadvantages, because in order to get the immunization route to have full absorption, you need a very high dose of the antigen administered. And also, for certain pathogens, it can mean that the person will shed the infection in their feces. So this is an important disadvantage. And then finally, a very new route, which is still in a developmental phase. It's called the transcutaneous immunization route. like I said, a very new development. And so far, some studies have shown that by giving an epidermal patch which has certain microneedles in it, as you can see here, might be a very effective way of delivering a vaccine to a person and eliciting an immune response. As we know, there are many immune cells inside the skin, so the researchers have shown that it is very effective at generating a broad immune response. After the antigen enters through the skin, through, for instance, a microneedle patch, it will make its way to the lymph nodes, and in a similar way as I've shown in the other vaccines, will induce an immune response, generating T cells and B cells, which will make antibodies. A very important advantage of this method is that it can be easily administered. Some studies have even shown that in certain cases a patient can administer the vaccine themselves. Also, as I told you before, there are many immune cells inside the skin, so researchers have shown that it might be capable of inducing a very strong immune response. There are also disadvantages, of course. First of all, this is still under development, and second of all, the skin penetration is not always highly consistent. So it is very difficult to develop a method that will give the same amount of skin penetration and thus exposure to the antigen. And then finally, I think one of the most important parts of this webinar, how to communicate this to patients. When discussing immunizations with patients, it is very important to explain to them the way that it will be administered, and we need to do this beforehand, because if you do it beforehand, you will have ample time to manage their expectations, tell them whether it's maybe going to hurt or not, ask them what might help them in case of anxiety, for instance, address their questions, and the most important thing is to use positive words. So we know from a lot of research, for instance in children, that it helps to use positive words and to not speak of, for instance, pain or needles, and to also include parents in this counseling. And then finally, we come to our key takeaways. So we've discussed 4 routes of immunizations. They're all very different. The most common one is the intramuscular route, and then we have the intranasal and the oral route. And then finally, under development, the transcutaneous route. Thanks very much for your attention.